All right, professor and classmates. So today what we're going to be going over is, well, hold on, let me share my screen real quick. All right, so we're going to be doing dissociative disorders for my project. All right, so we're going to start off with what are dissociative disorders? So these are disorders which involve disconnections between thoughts, memories, feelings, actions, or even the sense of who they themselves are as people. Yeah. All right, so there are many types of dissociative disorders. The two including dissociative identity disorder, also known as multiple personality disorder, or depersonalization/derealization disorder. There's also PTSD, which is also, dissociative, but we're just going to do the two that I have chosen. All right, so we're just going to go right off the bat with the most prominent disorder in dissociative identity disorder, which is like one of the most common, most seen in movies and magazines and articles and stuff like that. So multiple identity disorder, it's also known as DID, which involves the presence of two or more different identities or personalities, which each have their own way of perceiving the environment. So they each have their own personalities, even though they're the same exact person. And you could see them, on the streets, you could see them every single day, and you're not going to know which person you're getting unless they identify themselves as each identity. So yeah, it could be pretty scary, but it makes it important to truly understand this disorder, especially if you know someone like this. All right, so we're gonna talk about depersonalization and derealism disorder. I recognize that there's a lot of information on this screen, so I'm just gonna sum up just so, because I understand that you can read it. It's basically being outside of your own self, being disconnected from reality. You could be working and just have a split second or minutes or even hours that this could be where you're just watching yourself, or everything's you're doing the same thing that you always do, but you're not really paying attention to what you're doing or your surroundings. Yeah, so your experiences of unreality, distancing, or being an observer of your own thoughts, so you're out of your own body. So yeah, that would be depersonalization, and derealism, which would be disconnecting from your memories, feelings, and consciousness. All right, so obviously you're gonna, when you get you can't just diagnose yourself with this. There obviously has to be guidelines to get diagnosed with DID. So it's defined as a disturbance or alteration in the normally integrative functions of identity, memory, or consciousness. So for DID, which is also, multiple personality disorder, there must be a presence of two or more identities, which each have their own, different patterns of existing. They can either be self-reported, or a therapist could, see to diagnose. To have this diagnostic, they must go under amnesia, so they can limit how much a person can remember about traumatic events and daily occurrences. So, each identity can come through. They have to have difficulty in their daily function. The symptoms aren't part of, regular religious practice, and they can't result from alcohol or medication. It has to be, how they are sober and how they are, on a daily occasion. So to diagnose depersonalization or derealism, Dpdr, They have to have at least 3 persistent or recurrent episodes of, these things. They have to understand that what they're feeling isn't real and that, it's just in their mind. They have to know that. And they have to have significant distress or impairment of social or occupational functioning, which pretty much means like they have to experience this, and like it has to be something, like legitimate. A doctor has to make sure that there's no other reasons, such as drug use, a seizure disorder, or other mental health problems. That way they can do an appropriate diagnostic, and they could, provide the right care and even medication for it. They also have to do various testings in order for all this to occur, which can include imaging and other tests just to rule out physical issues. So to diagnose that this is its own thing, they have to make sure it's its own thing, like there can't be other things that play a role so that they don't give an improper diagnostic. All right, so now we're gonna talk into, what it's like to live with DID. So a person with DID is gonna have 2 or more identities or alter egos, which take control of the person, and it can cause them to have a loss of memory because the person that they are is now a different person. So obviously the person that they, the number 1 person isn't going to know what number 2, number 3, number 4 did because it wasn't them at that time. Other symptoms could be an inability to recall childhood memories. They could feel detached. They could have flashbacks of forgotten memories that occurred. They could lose chunks of time, because other identities were in control. So they're going to lose the time because they weren't in control. And yeah, there's going to be like thoughts of self-harm or suicide, and they're going to hallucinate. So life with depersonalization / derealism disorder, they're going to feel detached from themselves randomly or also in moments of extreme stress. Like I know for myself, I have anxiety, and when I'm going through a situation that's giving me anxiety, like for example, work, I can like recall just zoning out completely and just doing what I'm doing, but like being like, okay, so what was I supposed to do like after that? Or just knowing what I'm doing and being fully aware of what I'm doing, but just feeling like I'm just going through the motion, or just being unconnected to my mind, body, feelings, or sensations, just feeling like I'm a robot and I'm just doing what I'm doing. So yeah, these are, all the symptoms that can include. And then you're feeling numb to whatever's going around, but you can't like describe how you're feeling or whatever. All right, so we're gonna, who's typically affected by these disorders, and it's mostly women who are more likely to experience it because, we deal with more things. Not saying men don't deal with stuff, but we're more in tune with our emotions and, just psychologically, and like it's what happens. Not saying men can't have it, they can. All right, so causes of DID. So trauma is 90% of people who have dissociative identity disorder have a history of past abuse. So it's also connected to PTSD. So having DID, there has to be some sort of abuse that has gone with it to trigger different personalities coming out at a given time as a way of coping. People with DID, they often report physical and sexual abuse during childhood and frequently have concurrent symptoms of borderline personality disorder, where they have different personalities. It can also include instability in relationships because there's different people, and impulsive behaviors. So some of the causes of DPDR, severe stress, anxiety, like what I experienced, depression, can also trigger DPDR as a way for the brain to cope with what has happened in the past or what is occurring in the future. A lack of sleep or overstimulating environment like work or school can also make the symptoms worse. Anywhere between 25 to 50% of the time, the stress is minor and not even obvious. And often people with DPDR also have experienced past trauma in their lives, which can include witnessing domestic violence, emotional or physical abuse or neglect, or having a loved one die unexpectedly. So again, these are just ways of the brain coping. So they, disassociate or they become a different person. So I'm just actually going to go back to derealism. It's a sense of feeling detached from your environment. The world can seem distorted. You can have a heightened aware of your surroundings. So that's usually typically what happens with me, where if I'm just working and I just zone out, and then I'm like, okay, this is what I'm doing. All right, so a best course of treatment for DID is psychotherapy. This is where, it's helping the person integrate different personalities into one identity. So they're taking each identity and they're trying to form it into one psychologically. So amnesia is going to have to happen. So each identity can understand, hey, they can't be there anymore and they have to form into one. Everyone's going to be different because everyone goes through different stuff, obviously. But therapy usually helps on processing these traumatic memories, which causes the coping. It's obviously going to improve relationships with others, and they're going to learn how to cope in a way that's not that. There's also different forms of therapy, which can include cognitive behavioral therapy, dialectical behavioral therapy, and eye movement desensitization, and reprocessing. So these terms, if you aren't familiar, I do have them in the Quizlet, so you could check those out. There isn't any specific medications, but your healthcare professional could prescribe antidepressants or anti-anxiety drugs to help ease or relieve symptoms. So it's not going to treat it completely, but these different medications could help relieve some of the symptoms, because anxiety and depression do play a role in it as well. For DPDR, psychotherapy is the most effective therapy. It's going to, teach you strategies for blocking these obsessive thinkings about feeling things that aren't real. It's going to make sure you're more in the moment, and it's going to, teach you how to have better coping mechanisms. And it'll, you'll still probably dissociate, but not as much as you usually would. These psychodynamic techniques, they focus on working through the conflicts and the negative feelings, and it allows you to, again, learn coping mechanisms. There's also EMDR, which was originally designed to treat PTSD, which is, again, another form of these disorders. It's often used to treat a variety of mental health conditions, including DPDR. So, that's going to help too. Again, there's no medications approved specifically for treating it, but anti-anxiety medications and antidepressants are definitely going to help to at least ease some of it. So that's very important. And these are my references. I mainly used these two websites, but I did look at the other ones, to help me further my research and to further understand what these disorders are. And yeah, so that's my presentation.